Hello guys, welcome to Daily Ayurveda Gyan. So our today's topic is Nidana Panchaka. Okay, so Nidana Panchaka, it is a very important topic as point of Roga Nidana. If you have a Roga Nidana paper, then you can find this Nidana Panchaka either for a long essay or for a short essay as well. Apart from this, understanding Nidana Panchaka is very important because whenever the patient comes, this will be helping you out to rule the condition, to plan the diagnosis, and to understand the pathology as well. Okay? So before this, Nidana Panchaka, what does this Nidana Panchaka includes? Nidana Panchaka. So Panchaka means 5. Okay, so there is something to occur a Nidana, there is something 5 causes or 5 factors are present. Okay, so what are those? First is Nidana, then comes your Purvarupa, Rupa, Upashaya, and Samprapti. Okay, so these are all the 5 factors. So 1, 2, 3, 4, and 5. Okay, so Nidana, as such, it is Hetu. Hetu means it is a causative factor. Then Purvarupa. These are all the Purvarupas are the hidden sign or a hint, or you can call it as a vague signs. Okay, before the occurrence of a proper symptoms, before the occurrence of the symptoms, this vague or the hidden symptoms you can find. Then Rupa, as such Rupa, these are all the prominent clinical features which you can see in a patient. Then comes your Upashaya. Upashaya is nothing but it is a therapeutic test. Okay, so what happens here is you can be able to find out whether a patient is getting either relief or aggravated by the medicine. Okay, so Upashaya basically it is a therapeutic test. Okay, and then comes the Samprapti. Samprapti all knows it is the pathogenesis which occurs in a patient. Okay, so first we will start with whenever the Nidana Panchaka is being asked, first you need to mention what does actually Nidana Panchaka includes. So these all Nidana Panchaka includes. So first we will be dealing about the Nidana. So Nidana, the reference for Nidana is Charaka Sutra 19th chapter. You can look out the shloka number 3. So I have said you many times before in your paper you need to mention the reference. Okay. So Charaka Sutra 19th chapter 3rd shloka. You can see the shloka. Shloka goes like Hetvaha. So shloka is like Hetvaha Prakritir Vikrutir Linganam Upashayaha Sampraptischa. Okay, so what does the shloka tells you is Hetvaha, Hetu. Okay, Hetu. Then comes your Prakritir, that is Prakriti. Then comes your Vikrutir, Vikruti. Okay, Linganam. Linganam is like Linganam or Lakshanam. Okay, it is one and the same. Linganam Upashayaha Sampraptischa Roganam. So what he is telling is, what is Nidana he is telling? Hetvaha is Nidana, Prakritir, Vikritir, Linga, Upashaya, Samprapti. These all factors are helpful or together. All these together helps in understanding a disease. Okay. So he is telling Hetvaha, Prakritir, Vikritir, Lingam, Upashayaha, Sampraptischa. Roganam Nidanam means to understand the roga. These all factors together helps in understanding the disease or the roga. Say for an example, you need to mention the example in your paper. So example, just tell of Amla Pitta. Okay. See, for Amla Pitta, occurrence of Amla Pitta, what is the causative factor or the Nidana? So intake of Tikshna, then Ushna, Amla Dravyas, okay, then comes your stress, then anger, etc. So these all are, I'm just giving you some causative factors. So these all are the causative factors for the occurrence of the Amla Pitta. So these are all the causative factors, which is Nidana. For occurrence of the Amla Pitta, intake of Tikshna, Ushna, Amla Dravya, stress and anger. These are all the factors. If you do excessively in all these things, it will lead to Amla Pitta. So this is the Nidana. Then comes your Purvarupa. Okay. So in Purvarupa, so the reference is Madhava Nidana, first chapter, third shloka. You can look out the shloka from Madhava Nidana, first chapter, third shloka. The shloka goes like this: Roga Purvani ya Lakshanani Tikshnam Purvanim Prachakshitaha. So what is it telling? Madhava Nidana, you can look out the shloka number. Madhava Nidana, first chapter, third verses. You can see there. Roga Rogam Purnani ya Lakshanani Tikshnam Purnavani Prachakshate. So what does he says is, in Madhava Nidana explains this Purvarupa as, he tells it is a vague or a hint. Okay, so this is the signs which occurs before the symptoms, I mean the original symptom of a disease occurs. This Purvarupa you can be seen. So it is basically the vague one. Okay, symptoms before disease fully manifested or fully developed. Okay, before that you can see the signs. That is only known as Purvarupa. Say for an example, if you take the example of say Prameha. Okay, if you take the example of Prameha, you will feel excessive thirst, then tiredness, heaviness in the body. Okay, so these are all the Purvarupas. I'm just telling you the few. So these are all the Purvarupas for Prameha. So before occurrence of the main symptoms, you can see excessive thirst, tiredness, heaviness in the body. So these are all the Purvarupas for the Prameha. Okay. Now let's go for the other one, which is known as Rupa. Okay. So for Rupa, the reference is Charaka Vimana, 4th chapter, verses is 8. Okay. So there you can see the shloka, Tasya rogasyaha lakshanani bhavanti tani rupani. Okay, so this is the shloka which goes Charaka Vimana, 4th chapter, 8 verses. So what does here he tells? These Tasya rogasya. So before the Tasya rogasya lakshanani bhavanti tani rupani. So roga have been occurred, and lakshanani, the symptoms or the lakshanas which is seen is nothing but the rupavastha. Okay, so this is what the Rupa, this is how Charaka Vimana is being explained. So he gives you the example of, I'll give you the example of Amla Pitta. See, in Amla Pitta, you can see the lakshanas as acidity, then comes heartburn, nausea, then bitter taste, that is Amla Udgara. So like this you can see the lakshanas. So these are all the prominent or the Rupa lakshanas which can be seen in a patient. So at that time you need to understand it is the stage of Rupa Avastha. See, nobody will come, very rare the patient comes with the Purva Rupa Avastha. Majority comes either in Rupa Avastha or in Upashaya Avastha. Okay, or in Samprapti Avastha. So you can see these things. And then comes next is your